Hello everyone, welcome to this channel. In my last video, I talked about lymphatic systems, basic introduction and anatomy. If you want to see the video, then click on the button and watch the video now. Today I'm going to talk about our next part of the lymphatic system, basically our lymphatic nodes. Okay. So in my last video, I told about that in our body there are more than thousands of lymph nodes are present. Among them, lots of lymph node, almost 500 to 600. Lots of lymph node are forms a group or presence in some location as a cluster shape. Okay, so we call them lymphatic groups. Among them, 2 or 3 groups are extremely very important, which comes always in your exam, any kind of exam, any kind of viva. Okay, as you can see in this photo, you can see the lots of segment in the body where the lots of lymph nodes presents as a cluster form. So one by one I'm going to tell you about that. First of all, this occipital area. Okay, then you're gonna get behind the ear mastoid area, and in front and the below part of the ear near the angle of the mandible you will get the parotid part. Okay, so the cluster of the lymphatic nodes you will get the mastoid, parotid and occipital. These are comes in head part. Okay, now in the next section you will get superficial cervical lymph nodes, deep cervical lymph nodes and supraclavicular lymph nodes. Okay, these are forms a cluster. First of all, you're gonna get level 1. Now in level 1 you're gonna get level 1A, level 1B. 1A comes under submental and submandibular. Okay, this is the mentum area, so below this submental, this is the mandible, so below this you're gonna get submandibular. So submental lymph nodes, submandibular lymph nodes. 1A, 1B, finish. Level 2, here you're gonna get upper jugular nodes. Level 3, middle jugular nodes. Level 4, inferior jugular nodes or the lower jugular nodes. Okay, in the jugular vein, both sides. So you're gonna divide these jugular nodes into 3 parts: upper, middle, lower. So among this entire segment or all of these segments, there are lots of clusters of lymphatic nodes. So upper jugular level 2, middle jugular level 3, lower jugular level 4. Okay, in level 5 you're gonna get posterior triangular nodes. I will talk about this posterior triangle in a special video. So in level 5 you're gonna get posterior triangular nodes, right, left side, right side. Okay, in level 6 you're gonna get pretracheal, paratracheal and precricoid. Okay, pretracheal means above the trachea, paratracheal means surrounded by the trachea. Okay, and precricoid means above the cricoid cartilage. Okay, that's it. Now one important thing, some textbooks includes the supraclavicular lymph nodes as a level 7. Importance of the left sided supraclavicular lymph node is that it is also known as Virchow's node. Okay, this name is very important and it comes always in exam. Okay, that's it, nothing else. Importance of these lymph nodes I will talk about in the disease part later, not now. Now after the cervical area you're gonna get in the thorax. In thorax you're gonna get mainly the lungs lymph nodes. You're gonna get subsegmental, segmental, lobar, interlobar, along with the hilar lymph nodes. Okay, now after that you're gonna get mediastinal lymph nodes. Okay, now in abdomen you are also getting multiple lymph nodes. First of all you're getting pre-aortic lymph nodes, I mean before the aorta. Here you are getting celiac lymph nodes, gastric lymph nodes, splenic lymph nodes and hepatic lymph nodes. Okay, also superior mesenteric, inferior mesenteric lymph nodes. Okay, and behind the aorta you are getting retroaortic lymph nodes. Now after the abdomen, in the pelvic area you are also getting like nodes, multiple nodes surrounded the vessels. So you're gonna say that common iliac lymph nodes, then external iliac, internal iliac lymph nodes, both sides. Okay, right side, left side. After these nodes, in the lower limb you're gonna get external inguinal lymph nodes, internal inguinal lymph nodes, popliteal lymph nodes. Okay, and in the upper limb you're gonna get superficial lymph nodes and the deep lymph nodes. Okay, now the second most important lymph nodes you're gonna get in the axilla. Okay, right, left, both. First of all you're gonna get anterior or the pectoral lymph nodes. Okay, then you're gonna get posterior or subcapsular lymph nodes under the subcapsularis muscle. Okay, then you're gonna get lateral lymph nodes, central lymph nodes, and infraclavicular lymph nodes, okay, under the clavicle. Also you're going to get apical lymph nodes, okay. So all these groups are important for metastasis or the cancer purpose, mainly in women in breast cancer, okay. I will talk about these things later in disease chapter, not here, okay. So this is all about basic classification of the lymph nodes in the body. I hope you a little bit understand and you can remember these important cervical and axillary nodes, very important for your exam. So subscribe and share. Till then, bye.